This week on To the Contrary.
First, this Equal Pay Day, Black women share their stories of workplace discrimination. Then, Hillary Clinton reemerges to criticize President Trump's record on women. Behind the headlines, what will happen to the federal offices of women's health and how that could change your life.
I'm Bonnie Orbea. Welcome to the Contrary, a discussion of news and social trends from diverse perspectives. Up first, Black women at work.
As Equal Pay Day nears, we take a look at the unique issues women of color and particularly Black women face in the workplace. Equal Pay Day is the amount of extra time women must work until to earn the same amount as men earned in the prior year. This year, it's April 4th. According to the Institute for Women's Policy Research, white women make 78 cents for every dollar a white man makes. Black women make 65 cents. High-profile incidents of black women being rebuked while on the job have spawned the viral hashtag Black Women at Work. First, Bill O'Reilly apologized for making a dismissive comment about Representative Maxine Waters' hair, and White House Press Secretary Sean Spicer was accused of losing his cool at journalist April Ryan. In a contentious interaction, he told Ryan to stop shaking her head as she asked him how the White House is working to change its image after several weeks of bad news. Black women took to social media to share incidents of discrimination. Advocates see these attitudes as a barrier towards economic equality.
So, Congresswoman Norton, how should the U.S. address the unique situations that Black women find of discrimination in the workplace?
Short answer, Bonnie, by focusing on them instead of assuming that whatever small progress white women make will whitewash onto Black women.
Well, first, Black women need to be careful they're not being hypocritic. But then beyond that, we need to treat each other very seriously and look at Black women like we look at our white daughters or other daughters of every color.
Well, I think education is always important for the future generations to make them aware that this is the case. And we also need to watch our state laws that are being rolled back right now, making it more difficult to bring allegations of unequal pay and discrimination in the workplace based on race and gender.
Teach women of all colors to stand up for themselves, and in the case of Black women, show hidden figures in every school.
Ain't that the truth? But do you expect any significant action out of this White House, and I'm going to ask you too, so don't get upset, to help Black women reach pay equity? I mean, 65 cents on the dollar is clearly a lot worse than 78 cents.
You know, the president is going out of his way to try to show Black people that he's really for them. We had our officers from the Congressional Black Caucus to go over to the White House. It's all show. His budget much more hurts Black people, not to mention Black women, much more. A lot of what he's doing, like his executive orders, are not dressed at doing anything but instructing agencies to do what they could already do. So we don't see anything but show stuff. You saw it in Women's History Month this past week, and you certainly are seeing it with his speaking up about Black people whenever he can. But
HBCUs.
HBCUs, no money. So you can speak up and yet do nothing for them. Not that easily fooled.
Well, I'm just going to say, I mean, the best thing you can do for all Black people is to ensure that we have opportunity, that we can increase our wages. And part of that at the federal level, I mean, we can look at ways to cut budgets that are and duplication of jobs. But at the state level, and you talked about the states, roll back occupational licensing regulations that particularly hit communities of color and make it harder for you if you want to be a barber or a hairdresser or a makeup artist, be able to get into that occupation very quickly. But, you know, just to the larger conversation about Black women at work.
But on the other hand, if African-American women want to reach pay equity with white men, they're not going to do it being barbers or hairstylists. They're going to do it by going to Wall Street. They're going to do it by becoming lawyers and doctors. And so I don't think, rolling back regulations so they can become lower paid workers is going to really help them at all.
So, I'm not going to say that there isn't a pay gap in general, but I am going to challenge the fact that it's 77 cents or 80 cents according to some of the numbers. Let's just talk about the myth of the wage gap, in that when you control for certain factors, it disappears significantly. Now, does it exist for black women? Yeah, I'm sure it does. Some of that is the onus is on us as individuals in the careers we go after. Many young women I know go into sociology and the social sciences that don't get paid the same level.
And I know you want to jump in here and inform us, since you're on the inside, what the administration is doing for African American women.
It isn't just for show. You have to know what's in his heart. You don't know what's in his heart. But I do know from the interaction I've had, and also that several black groups and black individuals have had with him through the years, they would tell you the man is sincere. He wants to achieve for everybody, and with a special emphasis right now on minorities and trying to improve their lot. What Ivanka's going to be working on will not only help, white women, it's going to help black women too.
But let me just say, the two bills that he signed, not the executive orders, they were touted, I think, as executive orders, but he was signing bills approved by Congress, had to push women and women of color into STEM jobs, as the delegate said, had $0 behind
those
it.
were executive orders.
$0 so far. Most of his executive orders have been aimed at rolling back regulations to stimulate the economy and create jobs, which ultimately is what helps everybody. Good jobs, not the part-time and low-paying jobs that were created over the past 8 years.
Deborah.
Wow. I mean, I hear all
You gave
this.
me the last word on purpose.
I got to tell you, I'm not so sure I care about what's in his heart as much as I care about what the actions are. It's kind of like George W. Bush said, I looked into Putin's eyes. I don't care what you saw in his eyes. I care what actions are. And I don't think that the actions of this administration so far are showing a concern about women, either white women or African-American women. And I certainly think what Sean Spicer did is horrible. And I don't think he would have said that to a Brian Williams.
Okay,
Stop shaking your head.
I need to
and
jump
that
in.
comes out.
I need to jump in.
Well, you don't have to.
Thank you. First of all, it's only been 70 days. But secondly, even more importantly, Sean Spicer is an equal opportunity twit when it comes to insulting people. I mean, ask Jonathan Karl. I think he'd tell you.
Or the white woman from Politico who he called an idiot.
Right. He insults everybody. So, and Melissa McCarthy, notwithstanding her performance, shows
Which
that
is
he
hysterical.
does. It is hysterical. I want him to get the super soaker and bring it out there. He did actually say during one of the things, "Don't make me move the podium," which I thought was really funny. But no, he's kind of a twit and insults everybody. So she should take it as a compliment. He treats her like the men.
All right,
Okay.
Let us know what you think. Please follow me on Twitter at Bonnie Urbay or at To The Contrary. From women in the workplace to women in the White House.
Hillary Clinton emerged from, in her words, the woods this week and made her most political remarks since losing the White House race. At a California businesswomen's conference, Clinton encouraged the audience to keep resisting. Clinton said the defeat of the Republican health care bill was a victory for Americans. She also expressed being appalled by a picture of an all-male group discussing women's health care, and she criticized the Trump administration for its lack of diversity and for appointing only 4 women to cabinet posts. President Trump painted a different picture when he spoke to a women's empowerment panel. The president said he's proud of the involvement of women in his administration and wants to make America a place where women can succeed. He praised First Lady Melania Trump, who was in attendance and in Washington this week, making a number of rare appearances. The White House announced Ivanka Trump will take an unpaid federal job acting as her father's assistant, an unprecedented move for a presidential family member.
So, Ann, let's start with Hillary. She's back in the political arena.
In the saddle.
And is that good or bad?
Well, it's interesting. I think it's fine, and I'm sure she'll have some interesting things to add to the discussion. But I actually had one of my more liberal Democrat friends say to me that she's actually not happy she's back. In fact, she wants to see both Hillary and Nancy Pelosi retire, that she thinks it's time for the new generation. So I thought that was striking, that this person who has worked with them and loves them just thinks it's time for them to go away.
Well, Hillary is the best-known woman in America. She's still got a lot of stuff left with her. She almost won a presidential election. She didn't hold anything back this past week. She should be out there. She is a legitimate spokesperson.
Well, and I think what's interesting is going to be Ivanka Trump. And I think the backlash we've seen from the Twitter hashtags against her is just because she is a very potent, very powerful, very articulate young woman who doesn't just espouse traditional conservative values and beliefs, but also starts to bleed into some of the traditional democratic
But let's have
ideas.
a discussion about how powerful she is. What has she been able to get out of her father financially? Which is really the most, you can sign all the executive orders you want saying how great women and women of color are, but if you don't put money behind it, you've essentially done nothing.
Well, and, as to Ann's point, this is still pretty early on in the administration, but the idea that conservatives are starting to talk about things like paid leave and family leave, I'm pretty young, but I don't remember this in past presidential campaigns being an issue, and she brought it to the forefront during the presidential campaign. Now it's becoming part of the discussion, and it's here to stay. So now we have an opportunity to talk about alternatives to federal mandates and state mandates, things like personal care accounts that conservatives can get behind. She is powerful, and I think the left is very scared of her.
Well, if she's that powerful, then I would invite her to discuss with her father and Republican members of Congress the latest bill that was proposed that cuts out maternity benefits for women and maternity leave.
You're talking about health care.
Yes.
The health care bill, which would not pay for pregnancy.
Exactly. That's a huge issue. So it's great to say, oh, paid family leave, but you know what? We're not going to pay for you to have that baby. We already do have some paid family leave act out there by the Democrats, and we do have some requirements on that. Coming to Hillary and coming to Nancy, I find it very, very interesting that people want them to go away when they're some of the most powerful women we have seen in our history that are our leaders. That doesn't mean we can't use younger women. That doesn't mean we shouldn't promote bringing them up the ladder. I don't want to see them go away. Why would I want to see them go away?
Well, keyword is proposed. Bills like that are not going to make it all the way through. Ivanka is only just begun. She got settled, got her kids settled, all that, and they've now worked through the ethics process. That's why now she is actually an employee. There wasn't a lot she could do to force the issue of finances or whatever until this week.
And
so
as an unpaid employee subject to ethics rules now, is she going to get into ethical trouble the way her father and many of the cabinet members have?
I would bet not. They're being extremely careful, plus she's married to a very smart lawyer. But you talk about power. Yes, we don't have as many female cabinet secretaries as we've had maybe since George I, I think. But two of the most powerful people in that White House are Kellyanne Conway and Ivanka Trump, and I wouldn't want to go against them if I were any of the male cabinet secretaries.
Okay, I'm just going to say this. Having both of them there, then, I do not want to see Kellyanne promoting Ivanka's shoes.
And I think that was
Congresswoman.
Should be wearing them.
I know Ivanka because of this Trump hotel. It was my bill. Never thought Trump would get it. She is really
your fault.
Don't blame it on me. She's really a quite talented young woman, and if he deploys her well, as he has not deployed the rest of his family, she could do him some good.
Yeah.
All right, but what behind it? I'm curious. What behind it has any effect? Because I happen to know of a woman who served under a Green Republican governor in his cabinet who was called because Ivanka was supposedly going to a movie star who's very involved with climate change. She went to him to ask for people to nominate to the EPA who are Green Republicans, because there aren't that many of them out there anymore. And she was asked if she would be interested in an under or deputy position, and she said, well, it depends who it was. But she was lobbying for a Green Republican, and who he appointed to head the EPA is hardly that. No. So that spoke volumes to me about Ivanka's lack of clout with her father.
But Zinke is much more green and much more green than a normal Republican appointment would have been.
Are you talking about Pruitt or?
No, Zinke, not Pruitt. You're right about Pruitt, but Zinke, and it was the Trump children that were very much for him. So she's going to win some battles.
You're talking about it in Interior.
Right.
Okay.
She's going to win some battles and lose some battles, so be it. I mean, but the point
But in
is,
the environmental community, Zinke is not being seen as green. He's being seen as, yeah, let's preserve them as federal lands and lease them out to the oil and the coal companies and destroy them in the process. They are not happy with him.
He's seen as better than others that they were considering. So.
Well, when you go, yeah, I think they see, you know, at a scale of 0 to 100, if somebody is 100% anti, maybe he's only 99%.
It's much lower than that, but anyway.
But the problem with his appointees really has washed over to his family, and nobody trusts them. Indeed, they trust them even less. Look, if this nepotism is a very bad deal, the reason that we have to be against nepotism, even if you're unpaid, is you can't treat your family in the same way you treat an employee. You're going to fire them? You got to hold people to the same standard that the average American is held to. It's impossible to believe, even if you intend, that you will do that when you give major positions to your family.
We survived the Kennedy administration with Bobby as AG. I think we'll be fine.
And we got a bill that said you can't do that anymore.
Right, exactly. Because of that, and because America was offended by it, they outlawed it.
Well, but earlier, I just want to say, anyway, I know it's on the state level, but I come from a very political family. We all worked together. My father-in-law was governor. We all worked on his campaigns as a family. We consider it a family business, and as far as supporting each other, and we all believe mainly the same thing. However, even though we advise each other in private, we bounce things off of each other in private, as a lot of families do. Certainly his administration as governor had people in place and around him who were paid and accountable for the advice that they were giving. And I think that's the problem that we're looking at, nepotism, but also there's no accountability here whatsoever.
Sure
there isn't. And then when Kellyanne says what she says, you know, about Ivanka's shoes and go do this, you know, his reaction is, well, I'm just reacting as a father. You shouldn't be, you know, attacking Nordstrom's. You shouldn't be attacking my daughter. But he's tweeting out as president of the United States on his Twitter account.
And her comment was, Kellyanne's comment was a snarky response to a stupid question.
Well,
that's what it was.
Let's go back to January, where the Department of Justice said it would be okay for President Trump to appoint his children. So, I mean, I think at the end of the day, do we need to ensure that there's accountability and that she's operating at a higher ethical standard? Yeah, absolutely, that is important. But I don't think. But going back to the example that you referenced, this is not the first time that we've had this before, and I just think it goes to the point that. Ivanka Trump is very powerful, and I think the left is very afraid of her.
I really got to correct that. Because with Bobby Kennedy, we got a rule that said a person can't have a paid position. Now we're having people evade the rule by taking unpaid positions. So if you're against nepotism, you got to be against nepotism.
All right, we're out of time on this. Thanks, Patrice, for joining us for this part of the show. Behind the headlines, women's health and the federal budget. One area that hasn't been discussed in mainstream media is what will happen to the 7 different offices of women's health with the new budget.
The 7 offices of women's health don't garner much, if any, publicity, but they provide much-needed action. Each of the offices exists to raise awareness about the fact men and women have very different medical issues and respond to drugs and surgeries differently because they have different hormones. The offices work to persuade drug companies to test pharmaceuticals and medical instruments in trials on women as well as men, and much more. Phyllis Greenberger is the Senior Vice President of Women's Health and a leading women's health advocate. She helped write the legislation to set up NIH's Office of Women's Health.
We knew from other ways that women were not necessarily or not systematically included in clinical trials. And so what we focused on initially was just making sure that women were included in clinical trials. And Congress looked at all the institutes to see what they were doing on women's health, you know, quote unquote. And frankly, it turned out that they weren't doing anything.
And now, more than 25 years since the office was set up, there are still critical issues it has not fixed in terms of testing pharmaceuticals on women.
Even though women were being included in clinical trials, number one, they were basically included in phase 3, which is after you test for toxicity and safety, which we, of course, wanted them to test before.
The Women's Health Office at the Food and Drug Administration has a completely different mission.
They've been very active in working within the FDA to focus on sex differences research, to get the companies, the pharmaceutical companies, to recognize the importance of the inclusion of women and minorities in clinical trials and doing sex differences and reporting it.
And the office at the Department of Health and Human Services has a slightly different mission.
I know they worked a lot on HIV/AIDS, sexual abuse, domestic violence. Recently, they had approached me, I don't know what's going to happen with it, looking at women and Alzheimer's.
There are also offices within the Agency for Healthcare Research and Quality, the Health Resources and Services Administration, the Centers for Disease Control, and the list goes on. The CDC office looks at violence against women as a public health issue, for example. These offices, like all federal departments, are under President Trump's hiring freeze and await with trepidation his budget plan to find $53 billion worth of savings to spend on defense. Trump and Congress could defund these offices, write 5 of them out of the Affordable Care Act, which is where they get their funding, or simply change their mandates to less controversial issues such as Alzheimer's or heart disease.
So, Dr. Susan Wood, thank you so much for joining the panel. You as former head of the Office of Women's Health at the FDA. So when you talk in technical terms about an Office of Women's Health within the FDA, I think most women would shut down and, talk about something else. But explain how important this is to women and to men.
It's really important because these offices are things that can't just be replaced by someone else doing the job, because their role is really coordinating projects across either the entire Department of Health and Human Services or even across the entire government, or to specific agencies like FDA or NIH. But they do things like make sure that the different agencies are doing different pieces around domestic violence and violence against women, or heart disease, for example, starting education campaigns so that women recognize the differences in the symptoms they might be experiencing and actually call 911. Or they work on make sure we're doing research on autoimmune diseases, and we're also getting the best treatment out to women on autoimmune diseases, which unfortunately disproportionately affect women. And all the way through to at FDA, for example, one of the key things we worked on was not just including women, making sure that the companies were submitting data that had women in them, but that we started to analyze that data for sex differences, for sex and race differences, so that we could actually find out whether it is safe and effective for women and for all women, or whether perhaps there needed to be different doses, or perhaps it had different side effects or different effectiveness. If we don't ask those questions, if we don't get that information, and if we don't let our health system have the benefits of that information, there are many segments of the population that don't benefit, men, women, of all stripes.
And in the current budget climate, and I want to bring you in, but just one more question. In the current budget climate, do you think these offices are at risk?
Absolutely. No, these are things that could, we have to wait until we see the budget. We have to wait until we know what Secretary Price thinks about a focus and a priority of women's health. Unfortunately, I'm not very optimistic right now, given both the budgetary constraints that have been proposed, but also because we haven't seen a whole lot of support for women's health from this administration.
Well, these offices are so far below the radar.
Absolutely.
That it's very hard to tell, except by the president's own attitude. And it does seem to me that he has some work to do that he could do by funding these agencies. When I first came to Congress, the federal agencies were not required to do men and women, and now we're getting to where we really need it with pharmaceuticals, and they still are not required.
All right, we are unfortunately out of time. That's it for this edition. To the Contrary proudly announces we are now accepting entries for our second annual About Women and Girls Film Festival. Find out more on our website, pbs.org/To the Contrary. Please follow me on Twitter, and whether you agree or think to the contrary, see you next week. Sorry, I didn't realize that. I didn't until I saw